to the Swiss Liver Patients Association, Swiss HIPAA. Today with the interview of PD Dr. Christoph Jüngst, Senior Physician at the Clinic for Gastroenterology and Hepatology at the University Hospital Zurich, with the topic of liver toxicity by mushroom intoxication. Welcome, Dr. Jüngst.
Hello, Ms. Bobson.
My first question, what are death cap mushrooms?
Death cap mushrooms contain a toxin. It's called amatoxin, and this is really very toxic. And the intoxication has a high lethality, and therefore only small amounts of these mushroom are enough to really cause severe toxicity.
How can it cause liver injury?
There is this amatoxin, and this amatoxin is resorbed in the intestines and transported to the liver, taken up in the liver cell. And this amatoxin blocks RNA polymerase 2, which is very important for protein synthesis. And when we have this blocked protein synthesis, then we get cell death and cellular necrosis and hepatocyte necrosis.
What is the average latency period?
Latency period is very short. The first symptoms arise about 6 hours after mushroom ingestion, and severe liver toxicity starts already 24 hours to 48 hours after mushroom ingestion.
What are the symptoms?
The first 6 hours, you don't have any symptoms. Then it starts the next 6 hours or 15 hours with the so-called gastrointestinal phase. You have diarrhea, severe diarrhea, maybe bloody diarrhea. And then the next phase, after 24 to 48 hours, it's the so-called hepatorenal phase. Then liver injury starts, and the patients then get hepatic encephalopathy, to coma, consciousness coma, and also get severe kidney injury.
Who is at risk?
At risk is potentially everybody who is collecting mushrooms and does not recognize the death cap. These persons are at risk.
How can you protect yourself?
Well, recognize it, and if you are really insecure after collecting your mushrooms, then show them to a mushroom control point. There is even a website where you can look it up and see where is the next one in your area. You can present the mushrooms there, and they can tell you exactly what is a death cap and which ones are nice to have at a meal.
What can be done if poisoning is suspected?
When it's suspected, it really has to be quick. Call the ambulance. Patients have to be transferred to the emergency department in the case of severe symptoms. If you're unsecure, you maybe have your symptoms before, after, let's say, 3 to 4 hours. You don't have so severe symptoms. You can also call Tox Info Suisse via 145. It's a 24/7 number, and they give you further advice. And keep the leftovers and vomits, and this helps then to identify the mushrooms later, or toxins.
My last question, as a specialist, what do you recommend or advise in case of liver toxicity by mushroom intoxication?
As just said before, it really has to be quick. If you're unsecure, call the ambulance, go to the emergency department, because then the doctors say they will start treatment even if the diagnosis is not settled yet, because it's very important to start treatment early. You get activated charcoal for decontamination. They will start the antidote silibinine that helps that the amatoxin is not again taken up into the liver cell. And this is really very important to start it as early as possible. And also, if there were other persons who having the mushroom dish with you together, maybe they don't have even symptoms, but they should also come to the hospital, be tested and be treated there until it's really sure that they don't have any intoxication.
Thank you very much, PD Dr. Jüngst, for your comprehensive and helpful interview, which is an additionally important source of information for patients. Thank you very much.
Okay, thanks a lot to you for this interview.